All right, so for the next drug of choice that we'll be looking at is Alteplase. Okay, so we'll be looking at Alteplase, the pharmacology of Alteplase. So you get to see that Alteplase has another name, and this name is what? Activase, right? So you see these are pictures of Alteplase. These are the pictures of Alteplase, Alteplase, Alteplase. All right. So how we'll be doing this is we look at the mechanism of action. We look at the indications. What do we mean by indication? Indication simply means what disease condition we will use this drug, right? Then we look at administration, adverse effects, contraindication, precautions, and all of that, right? So let's quickly look at this. So for Alteplase, we say that Alteplase is a recombinant form of human tissue plasminogen activator. So it's actually human tissue plasminogen activator. They kind of like what? Redesigned it. That's why they say recombinant, okay? So it is used as a thrombolytic agent to dissolve blood clots. So let me say in patients that have chances of their blood forming clots, then blocking blood vessel, you have this Alteplase, okay? You can use this Alteplase. All right, so looking at the overview, we start from the mechanism of action, indication, then what next? Administration, adverse effects of the drug, contraindications, and precautions that you should always take when you are using this drug, okay? So for the mechanism of action, we have it that this Alteplase works by converting plasminogen to plasmin, right? So it is actually what? An enzyme that breaks down fibrin, okay? Which is the main component of blood clot, okay? So plasminogen, that's the inactive form of the enzyme, will be converted to plasmin, all right? So thereby, the enzyme will now be there to what? Break down clot, all right? So this process helps to what? Dissolve the clot and restore blood flow again. Alteplase has what? A high affinity for fibrinogen, right? Which means it primarily acts on clots rather than the circulating plasminogen, all right? So what are the indications? Alteplase is used in emergency treatment of what? Acute ischemic stroke, just to dissolve clots that have formed in the brain and restore the blood flow again, all right? They can also use it for treating what? Acute myocardial infarction, where you use it to dissolve clots in coronary arteries and reduce the heart damage. They can also use it for what? Acute massive pulmonary embolism, where you are using it to dissolve clots in the lungs and improve oxygenation, right? Then central venous catheter occlusion. This one you are trying to what? Restore function to occluded catheters, okay? So basically, if you look at the summary, this drug is used for what? Dissolving clots, you get. So administration for acute ischemic stroke, you give about what? 0.9 milligrams per kilogram, okay? And you infuse intravenously over 60 minutes. Then for acute myocardial infarction, this dose is based on the weight of the patient, okay? And you shouldn't give it to exceed 100 milligrams. For acute massive pulmonary embolism, about 100 milligram is administered by what? Intravenous infusion over 2 hours, right? Then what are the adverse effects of these drugs? You know that it is what? Lysine is preventing clots. So it could actually down tilt the patient into bleeding, right? So bleeding is the most common adverse effect, including what? Intracranial hemorrhage. It could lead to what? Orolingual angioedema, right? Which is swelling of the tongue and the throat, which can be life-threatening. Then allergic reactions is rare but can include things like rashes, itching, difficulties in breathing. Okay. Contraindications when you shouldn't use this drug. If the patient has an active internal bleeding, you might not want to now use a drug that is further preventing clot formation again. So including if they had a recent surgery or trauma, then if they have a recent intracranial surgery or any serious head trauma, you shouldn't use this drug, right, due to risks of bleeding. Then if they have severe uncontrolled hypertension, this one is basically increasing the risk of bleeding, so you shouldn't use the drug. So what are the precautions? Monitoring. So continuous monitoring during or after administration for signs of bleeding or angioedema. Avoid intramuscular injections to prevent bleeding. Right. So for the conclusion now, Alteplase is a powerful medication that requires careful administration and monitoring. And this is due to what? Its potential its potential for serious side effect. Okay. So I think guys that's it for the pharmacology of Alteplase, also known as what Activase. Mechanism of action, indication, administration, that's basically a dosage, adverse effects, contraindications, and precautions.